Welcome to the Nurse Hustle. My name is Natalie, and we are going to get right into this topic. But before we do, I wanted to share with you that I wear my stethoscope when I come here because guess what? Once a nurse, always a nurse. I have been a nurse for 30 years, and even though I don't work in direct patient care, my assessment skills don't go away. Drop me a comment down below if you're a nurse and you know what I'm talking about. We assess our patients just like we assess our family, our friends. We can see someone in distress from a mile away. So so when I come here, I will always wear my stethoscope because I'm very, very proud to be a nurse. But this story today hits close to home for so many of us in healthcare, and it really makes me sad sometimes about the industry that I so wanted to get into. Just like many of you, I couldn't wait to become a nurse. And I recently spoke with a nurse friend of mine whose experience really drove home the challenges that we're facing. So her story is one of resilience, but it's also a wake-up call for the industry and for all of us. She told me about her hospital where the nurses union had just finished negotiating with management. Here's the deal they struck. And if you've been part of a nurses union before, drop me a comment down below because I have too. And I'll have to share my story with you another day because this one is just too much. The hospital promised not to enforce mandatory overtime if the nurses agreed to work under short staff conditions. Yes, you heard that right. They agreed not to ask for mandatory overtime if the nurses agreed to work under short staff conditions and not walk out. That's like being asked to choose between burnout now or burnout later. And let's not even get started on how that impacts patient care. I was just appalled that this is how the negotiating is going on, especially since we just had that incident with United Healthcare and Brian Thompson, the CEO that was shot. Listen, I did on my other channel, I did a video on that, and I'll have to get back to that another time because it just irks me. This is something that really bothers me, so I just couldn't even wait tonight. I'm so tired, but I had to come talk to you about this. Now, I want you to picture this. And if you're nurses out there, you know what I'm talking about. But if you're watching this and you're not a nurse, picture this. 5, 6, even 7 patients per nurse during a 12-hour shift. You're constantly running, barely able to spend 5 minutes with each patient. And let's face it, as nurses, we know every patient deserves more than that. I mean, that's barely enough time to listen to a patient's lungs. Now, studies confirm this isn't just anecdotal. According to the American Nurses Association, unsafe staffing levels lead to increased patient mortality. And we all know this, right? But by how much? By up to 7% for every additional patient assigned to a nurse. And nurses, we're leaving the profession in droves. A 2023 survey by McKinsey found that nearly 30% of nurses were considering leaving their roles within the year. The top reasons? Well, we know, don't we? Stress, burnout, and you guessed it, short staffing. We're tired. Nurses are exhausted. It's why I'm not currently working in the hospital at this time. I still work as a nurse, but I don't work in the hospital. So you're probably wondering, though, let's get into this part. Are you wondering, how do hospitals in union even get away with negotiations like that, right? Unfortunately, there's a broken system. How does the healthcare insurance industry get away with what they do? The system is broken. Profit-driven healthcare is a problem. And it's not just a problem for the insurance company, it's a problem in the hospitals. Hospitals often prioritize cutting costs over patient care. It's a fact. By keeping staffing levels low, they save money on salaries and benefits, and unions, while advocating for their members, are often put in a tough spot, forced to choose between bad options because hospitals hold the ultimate power to lock nurses out or threaten closures. Yes, you heard that right. The hospital holds the ultimate power to lock nurses out or threaten closures. So while we're ranting and raving that nurses are on strike, no, the hospitals hold the power to lock them out. Now, the other thing is, point 2 is that there are legislative I can't speak. Beg your pardon because I'm a little bit tired right now, okay? But there are legislative loopholes. In many states, there are no laws requiring safe nurse-to-patient ratios. Yep, you heard that right. There are no laws requiring safe nurse-to-patient ratios. California is the exception, but most other states allow hospitals to dictate staffing levels without legal oversight. This creates kind of a gray area where hospitals can negotiate unsafe conditions without breaking the law. So yes, they can, but guess what they know? We're going to talk about what they know later, and you're going to see how it is that they are prioritizing their budget and the cost over the patient. Now, with so many nurses leaving the profession, hospitals claim they have no choice but to operate short-staffed, right? But instead of fixing the root of the problem, burnout, poor working conditions, and low pay, they focus on temporary fixes that don't address the bigger issues. And let's face it, most patients don't even realize how unsafe staffing affects them until it's too late. Hospitals often frame these decisions that they make as necessary, right? We don't have enough nurses to work, so we have to work short staff. They reframe them as necessary compromises without acknowledging the risk to the patient and the nurses. Because, oh yes, the nurses are at risk too, because the nurses risk losing their license if they make a mistake. This isn't just bad for nurses, it's bad for patients, and research published in JAMA, the Journal of American, the JAMA, Internal Medicine, found that hospitals with high patient-to-nurse ratios saw a 19% increase in patient mortality within 30 days of admission. Think about that, 19%. That's someone's mom, someone's dad, someone's child, someone's grandparent, someone's brother, someone's sister. Should I go on? Someone's husband, someone's wife. So what is the solution? It's easy to feel powerless, right? But there are steps. The thing is that there are steps we can take. This is so frustrating, but we have to hold out hope. In California, where nurse-to-patient ratio laws are enforced, patient outcomes are significantly better. We need more states to adopt these laws. We need people that will lobby these lawmakers. If you're in a union, maybe you can push for similar measures. If not, connect with organizations like the National Nurses United that are advocating for change. And yes, I know it's hard. I've been a nurse for 30 years. Short staffing didn't just start yesterday. I spent almost my whole career short staffed. And though we can advocate, right? But what if we held the hospitals accountable? We need to push for transparency from hospitals. They should be required to disclose their staffing levels. This should be public information. I don't get it. This would allow patients and nurses to see whether their hospitals prioritize safety. Like, if you went to a hospital and they were a 2 out of 10, would you even go to that hospital? Would you even move to a county where that was the only hospital you could go to? You might rethink where you're going to live, wouldn't you? Well, if you live in Florida, like I do, you know, this could shortly be an issue here. Did you know something else? Did you know that some states have safe harbor laws? These laws let you legally refuse unsafe assignments without retaliation. Make sure you're familiar with the laws in your state, though. At some point, you know what I thought? I felt at some point, because after my second year working in the hospital, I transitioned to working per diem because of this mandatory overtime and all of this, all the same things, burnout. You know, in 2 years, imagine you work for 2 years as a nurse and you're already reaching burnout. You know, nurses have kids, they have families, kids, families, husbands, you know, like other things to take care of. Your whole world doesn't revolve around your nursing career, as lucrative and fulfilling as it is. And I know when I used to work at, I think it was at UPMC, University of Pittsburgh Medical Center, there were safe harbor laws in Pittsburgh at the time. I don't know if there still are, but you could refuse an assignment if it was unsafe. And the beauty of working per diem is that as a per diem nurse, you can definitely refuse an assignment that's unsafe, because it's not fair to you, it's not fair to the patient. You know, you don't know how many times in my career, you guys tell me, how many times in your career have you heard a manager, or nurse manager, or floor manager tell you, that's abandonment. You can't abandon your patient. Well, who abandoned the patient when they didn't staff the hospital appropriately? When the hospital was understaffed and the nurses were overworked and exhausted and they just had no choice but to quit and change careers. I honestly do not believe that nurses leave their careers because they don't like what they do. I love taking care of my patients. I loved it. What I didn't love was being overworked and understaffed. I know we're tired of hearing this, but protecting our mental and physical health is so crucial. If you're stretched too thin, don't hesitate to seek help. Burnout isn't a badge of honor. Therapy is amazing for your mental health, so definitely get some mental health care. And if bedside nursing has you at your wit's end, remember, there are other options. Consulting, per diem roles, gig work. There are ways to use your nursing skills without sacrificing your well-being and without completely leaving the profession. That's exactly why I started the Nursing Hustle, is to help nurses regain their control of their lives, because I know firsthand what that was like almost 30 years ago when I started to transition. And yes, I went back, and I think I mentioned I transitioned out, and then as I worked per diem, I worked in the hospital, and we can talk about that more in another video, but I want you to know that you're not alone in this struggle. We're in this struggle together. If you're tired, overwhelmed, or thinking of walking away, take a deep breath. There's hope, but we have to act. Share your stories. Push for better staffing ratios. And If you're ready to explore new opportunities and take control of your career, join me on the nursing hustle. Let's build a future where nurses can thrive, not just survive. I proudly put on my stethoscope when I come here, and it almost makes me want to cry because, like many of you who maybe have left the profession, I was burnt out. I didn't see how I was going to manage raising my children, getting them to football practice while working these crazy shifts and being at risk of losing your nursing license. That's the worst part. You're at legal risk. And no one's going to stand by you. Who's going to stand by the nurse who makes the mistake? Quick last story for you. I wasn't going to go on, but there's a quick last story. I was actually working a consulting gig at a hospital. And there was another nurse that came on. In this hospital, when you came on as a consultant, you're the outcast, right? The other nurses don't like it because they know you're getting paid more and they're not getting paid as much. You get paid more as a consulting nurse, as a, per diem nurse even, you get paid more. So that day I came in that morning and there was another nurse who had been given a one-day training like all consulting nurses. So you walk into the hospital, imagine you walk into the hospital, you have never been there before, and they tell you, here's the nurse's station, there's the med room, here's the narcotics dispenser, here's the utility room where you can get all your supplies for your IVs and your wound care. You get a quick half a day with a nurse, and then they give you an assignment. Now, as a seasoned nurse doing this, not too bad, right? Not terrible, because nursing is nursing. I can assess my patient, but how about the protocols and all of that? So anyway, to make a long story short, this woman accidentally gave the wrong patient insulin. And that's all she wrote. I will say no further. That patient expired. Can you imagine? This is what happens from being understaffed and overworked. There's animosity amongst nurses. It's just terrible. But anyway, and I know that nurses don't mean to be mean to each other. But it happens. Because there are some nurses that are not able to leave their positions for per diem work. Right? So that's not for everybody. But it is for some. And for those that have the luxury and the opportunity to do it, they are still at risk. And I will say that you might find some places where the nurses are just so tired that they're just happy to see just anyone there. But that little bit of animosity over the wages that they're not making, once the dust settles and they realize that they're not getting paid what you're getting paid, it's a shame. Because guess what? They deserve it too. So my video cut out because it's getting late and my phone died. But to my fellow nurses out there, all my fellow nurses, you're not alone in this struggle. We're in this together. If you're tired, overwhelmed, or thinking of walking away, take a deep breath. There's hope, but we have to act. Share your stories. Push for better staffing ratios. And if you're ready to explore new opportunities, take control of your career, join me. Join me on the nursing hustle. Let's build a future where nurses can thrive, not just survive. You know, we don't just want to be in survival mode. And you know what? I want to thank you for, don't mind me, I have my, so if I'm looking all over the place, it's because I'm holding my phone in my hand at this point. But thank you for listening. And remember, we have the power to create change together. If you found this helpful, like, share, and subscribe. Let's keep the conversation going, and let's stand up for what we deserve. Let's hustle smarter and not harder. I think I want to bring some of you on to share your stories, especially if those of you maybe who aren't working in the hospital setting right now. If anyone's watching that's not in the hospital setting, I'll drop my, I'll put my email in the description box. You can send me an email if you're interested. But I'd love to do story time. Like I just mentioned, there was, it just came to me as I was talking to you about this, this poor nurse that came into work that day and didn't know she was going to have such a tragic event. And, everyone just went on with their day, of course, because they had like 8 patients to take care of, right? So a med surge unit, 8 patients to take care of a piece. And, one patient expired due to a medication error. Wrong patient, wrong med. And, sentinel event. And so it's, she didn't know that was going to happen that day. She was probably taking on this per diem to help her family. So that's why I say also that it's really important to know yourself, know what you're capable of. And, when you're transitioning into per diem consulting work, you also have to be strong and firm and able to stand your ground. So there's, some things that you have to know. So I think like having a group and a community like this where we can talk as nurses and help other nurses that are or that I can talk to and help that have gone through, that are getting ready to go through some of the same things that I went through. I really think I was just fortunate. I mean, I'm a good nurse. I'm sure that other nurse was a good nurse too. But she wasn't as fortunate as I was. So anyway, I am sending you all peace and love. Like I said, let's hustle smarter and not harder. And let's do it together. Until the next one.